You are the last and the best. Please go ahead.
Thank you, Dr. Youssef, and I'm really glad to invite me to be among these great and distinguished speakers. I'm the youngest, and I'm here to learn from all of you, and I really do. So I know you're all tired, but I hope you're gonna change a bit of the mood and be active in this in my talk. So I would like to start with saying that. Although I'm a PhD holder with a solid background in biology and an already faculty member at EUB, but 2 years ago I decided to accept the position of the director of the Marigal Library and to be able to utilize all the possible tools to communicate science and become more influential in the society. I'm really trying hard to support and launch initiatives that help achieve the SDGs. This is a sincere and a great topic to my heart. So the EUB libraries indeed support EUB's overall mission, which is to provide excellence in education, to participate in the advancement of knowledge through research, and to serve the peoples of the Middle East and beyond. The library's direct and obvious impact is on SDG 4, quality education, which is to ensure inclusive and equitable quality education and to promote lifelong learning opportunities for all. So I was really questioning myself, why would I accept this position? What can I do to further influence the society through the SDGs? But I found out that our work towards goal 4, which is centered around quality education, in fact affects other goals. It's showcased through the library's role as the provider of information and research tools, which have a direct impact on goal 8, work and economic growth, on goal 9, which is sustainable industrialization and innovation within our communities, consumption and production patterns, goal 12, as well as on the implementation and revitalization of the Global Partnership for Sustainable Development, Goal 17. Attaining this set of goals support knowledge and access to data, which in turn allows for a more extensive space for creativity and for innovative opportunities through projects and solutions that are related to safeguarding our resources and conserving them, which ultimately influences most of the SDGs, in particular goals 6, 7, 14, and 15. However, all these cannot be done alone. So what about our scientific cooperation at the national, regional, and international level to achieve these SDGs? As the director of the library, I'm really involved in helping researchers perform their research plans, in collaborating with researchers, scientists, and healthcare practitioners from different countries in the world. These researchers are mainly involved in studying non-communicable diseases, different types of cancers, heart diseases, kidney diseases, which affect all of us. None of us couldn't be affected by these diseases. And much more recently, they're studying the coronavirus, which is an incredible example of how interconnected our world is. And for me, this is the great example of how much we must rely on each other for the greater good. So the researchers at these different faculties and centers at EUB, which I'm not going to mention just for the sake of time, they are involved in influencing health systems, management practices, and policies in Lebanon and in the region. The centers have strong connections to overseas institutions, and their faculty members have direct links with policymakers, stakeholders, and influencers, both inside and outside Lebanon. Our involvement with SDGs is also valid through our partnership with research and academic institutions, both at the national and the international level, to facilitate the access and exchange of information resources. We also try our hard to raise awareness and promoting open access publishing among the community, and my colleagues have previously stressed about that. We also try our best to document and preserve cultural heritage for future generations, and not to forget this with all the technological advances. We also collaborate with local, regional, and national civil society institutions and governmental organizations to be able to serve and engage and empower citizens. We try to do regular exhibits and workshops which are open to anyone, to the public, because information is a human right. We try to collaborate with a lot of engagements and civic engagement centers to be able to serve even the marginalized communities and not only those who are at luxury of having access to information. We have a lot of projects which showcase this collaboration between us and the rest. I'll mention one of them, which is the ACO, the Arabic Collections Online Project, which aims to digitize, preserve, and provide free open access to a wide variety of Arabic language books in different subjects. We have a lot of collaborators from New York University, Columbia University, Princeton, Cornell, Columbia, American University in Cairo, in addition to AUB. There are a lot of other projects and digital collections, but I cannot mention over here just for the sake of time. We also partner with a lot of libraries and entities in the world, like HathiTrust, Google Arts and Culture, and OSCs to work on several projects. The AUB University Libraries are also a member of the IFLA, the International Federation of Library Associations and Institutions, which is the global voice of the library and information professions. I've also had the pleasure to be a member of IFLA, a special interest group, which is Evidence for Global and Disaster Health Special Interest Group. This group works to promote and strengthen the role that librarians play in times of crisis and disaster and in response to global health challenges, which is supporting SDG 3, ensure healthy lives and promote well-being for all at all ages. I've had the pleasure to talk last month in August in the IFLA annual conference, where we talked about health as a human right for anyone. We are also collaborating with a lot of other university libraries locally and internationally through a lot of consortiums like the American International Consortium of Academic Libraries, AMICAL, LALC, Lebanese Academy Library Consortium, other associations like Lebanese Library Association and Medical Library Association. So we've been talking about that while we were in normal cases. What about the pandemic? The pandemic, which the recent one, the COVID-19, never before did we feel that we really need to attain these SDGs, and we really need to work together because no one alone, and the pandemic proved that no country was able to do this alone. This was also not only a pandemic, but also an infodemic. So believing in the importance of reliable medical information and the right of proper health for everyone, back in February 2020, and when the first case of COVID was announced in Lebanon, I felt that I'm really responsible. My work doesn't end in the classroom or in the lab or in the library. So I took the Trainer the Trainers workshop that was given by several ministries in coordination with the WHO, and I started from there providing awareness sessions in layman language about COVID-19 in schools, universities, villages, aiming to reach everyone in the community. A lot of people don't have the luxury of accessing information that we do have through our computers and access. We also launched an online awareness campaign to be able to ensure an online presence and platform to cater for the community's concerns and questions via social media channels and using specific hashtags. However, I felt that I cannot stop here. So back in March 2020, and with the tons and tsunami of information that was published about COVID, and being a biologist and researcher and teacher, myself, I felt confused of what to trust, what's reliable, what to do, how to take precautions. So I started working on my free, user-friendly COVID-19 Resource Center, which I started building, I can say, like a child, step by step. So I started putting information reliable from reliable resources, and I tried to make it target every one of us. So if you are a healthcare professional, you can find answers over here. If you're just anyone, a health consumer, a section is dedicated for you. If you're a faculty, a student, if you are in a specific MENA region, there's also sections for there. For mental health, I've added videos for sign language videos. So no one should be left behind and everyone should have the access to information. I can share the link with you in the chat. Unfortunately, I don't have the time to go over the 30, 40 sections that are in the guide. I'm trying to keep it updated till today after all this time, because we know that medical information changes every day. However, when I was looking at the statistics and the views, and I had a lot of views, still now 14,272 views. But when I looked at who is viewing this website and the countries and talking about Arab collaboration in this session, I would say that I had mixed feeling of being happy and sad. I was happy because I had a lot of views from internationally, from France, from the US, from the UK, Peru, India, and almost everywhere. But I was also sad because only like 2 or 3 Arab countries were accessing that and were sharing this. So I really had mixed feelings because I was sad like this could reach internationally, but is not being used, I believe, for my community, the Arab community. So the same goes for organizations and sites that shared this guide. So I found that a lot of international organizations and universities who I don't have any contact with them shared it, but unfortunately, very little of my organizations around made use of that. So I think this is one way where we should focus more on getting our hands together to be able to do something. So, and luckily throughout, because of this resource center, I was nominated as the first country representative for Lebanon in a global social movement called Healthcare Information for All, HIFA. So HIFA is really, I feel it's a great thing for me because it has more than 20,000 members from across the world. We work closely with the WHO. I was very glad that I was the first country representative for Lebanon because I share with HIVA their motto, together we can stop people dying due to lack of healthcare information. So I hope I would be able to spread HIVA more in the region and to have more representatives from other Arab countries. I was also chosen because of this resource center as INCSA, the International Network for Government Science Advice, policy-making tracker rapporteur for Lebanon. So where we're documenting all the decisions that were taken during COVID in Lebanon and based on which evidence, based on scientific evidence, or was it based on politics, based on what these decisions were taken. I wouldn't talk a lot about Arab Ways, which my friend Jawad had eloquently talked about that. We are both friends and board members in this institution, which I believe it's an initiative that influences scientific cooperation between countries to support the SDGs. Unfortunately, we lack a lot of funding, but we are still doing as much as we can to facilitate this linkage between people and youth, young scientists. We have around 18,000 young scientists who are in the region with the diaspora who are outside. So I love Arab Ways. We incubate a lot of young, promising scientists who are involved in addressing not problems which tackle one country, but transboundary problems, be it in health, agriculture, education system, natural resources, and others. I've also presented Arab Ways in the World Science Forum, and I've had the pleasure to participate in 2017, where I was chosen as the youngest woman, like today, to participate in a plenary session entitled Young Scientists Identify the Skills of the Future to Advance Science Diplomacy and Society. This really paved the way for me to believe more in the role of women. We shouldn't forget women and the gender equality SDG when talking about anything, in advancing the society through science and technology. So based on that, I was also nominated as a member of the organizing and steering committee for the World Science Forum 2019, where I talked about two main things: challenges that young scientists are facing mainly in the MENA region, and also about open access and responsible research across the globe and across society. Despite all this, I believe we are still at the beginning. There are many things to do for the future. I will just list some of them. We are obliged to create platforms for scientific cross-border collaboration for information sharing in the region. We should link existing diaspora networks and initiatives from the region with those outside the region. We should, and why not, develop a model similar to the European Union's scientific visa package, which facilitates the admission of researchers between Arab countries. On top of all, we cannot do anything if we don't change our mindset. We should change our mindset. We should consider all stakeholders, and science, and good science, should be put at the helm. It should be championed indeed. But at the same time, we should be humble because we know very little and no one of us knows everything. We should be open for a sharing culture. We should always stress the importance of communication and discussion. And we as scientists should not only learn the physics and the biology and the math equations, but we should also learn the skills needed by us to collaborate together. We should learn increased connectivity, transparency, critical thinking, ethical research practice, integrity, and everything. I hope that at some point in the future, I'll be able to link science and society, to be actively involved in the policymaking strata, and to engage socially by defending the rights of people to live in a decent way. Only together we can save the elderly, the immunocompromised, the children, our families, and can actually save the world. I'm sorry if I took a lot of time and I know you're tired. Thank you so much for listening, and I'm open for any question or for any comment. Thank you so much.
Actually, we want to